Hello, I'm Francine, host of Coping to Care, a podcast series sponsored by Blue Sea Care that features guests who share their expertise and life experiences to empower our loved ones in the community. Our aim is to serve as a relevant, genuine, and entertaining resource to help you triumph over the seismic changes resulting from COVID-19. Today, we'd like to welcome Dr. Julene Johnson, Associate Director Professor at the Institute for Health and Aging at the University of California, San Francisco. She is the Director of Sound Health Network, which aims to provide infrastructure for studies about music and health. Dr. Johnson also serves as the Associate Dean of Research for the School of Nursing. She is a cognitive neuroscientist and completed her postdoctoral training at the University of California Irvine Institute for Brain Aging and Dementia. Welcome, Dr. Johnson.
Thank you so much, Francine. It's really wonderful to be here. Thanks so much for the invitation.
Oh, absolutely. And I love that beautiful backdrop of San Francisco, the San Francisco Bridge. And well, can you tell us what your research program focuses on?
So my research has two primary themes. As a cognitive neuroscientist, I'm very interested in developing novel community-based interventions, particularly arts interventions that help promote health and well-being, particularly for older adults in the community. The second area of my research is better understanding cognitive function in diverse older adults. So, for example, diversity I define more as kind of diverse racial ethnic backgrounds and also socioeconomic backgrounds.
Very interesting. Now, a new report from the AARP Global Council on Brain Health recently found that music can potentially promote brain health, manage stress, and help treat brain health conditions as varied as dementia, stroke, and Parkinson's disease. I see that you are one of the brain health experts whose research has determined that incorporating music into your lives helps to improve quality of life and well-being. Can you share a little about this?
Sure. I think we can all agree that music is really a powerful way to engage our brains, but also to help us stay connected with others. And playing music, whether you're singing or playing a musical instrument or even dancing or humming along with the radio, involves several parts of your brain. It's quite remarkable. And we know that also playing and engaging in music can help improve quality of life. They also reduce stress, improve our social connections with other people, and also help people recall memories that are meaningful to them. And my recently completed study, the Community of Voices study, we examined how singing in a community choir helped older adults promote their health and well-being. And we found that after 6 months, older adults who sang in a choir reported less loneliness and more interest in life. So my research has found that engaging in different types of music, such as singing in a choir, can help promote well-being.
That's wonderful. Now, can you explain how the rhythmic nature of music and dance provide an external source for meter or pulse, which can help the brain restore impaired movement? I know you've done a lot of studies on this.
Well, we know that music and dance are closely linked, and music is particularly useful in motivating movement. I think what it does is it provides an external cue, such as a beat or like being in the groove, and you can kind of naturally move to music. And so this kind of helps stimulate our motivation to move. And we already know that dance and other types of physical activity are particularly good for brain health.
Great. And then also I see that to treat people with dementia, that it actually kind of takes away the aggressiveness a little bit and maybe the restlessness. So how is that it works? It's very complex.
Yes, it is very complex. So people perhaps living with dementia who might have some behavioral symptoms, we know from a body of research that either engaging in music or listening to music might help reduce some of those behaviors, such as agitation, some of the wandering, and anxiety that those individuals might be experiencing. But I think what we know, we've known for a long time now, for decades, is that the memory for music in people living with dementia, music is often preserved. And we hear many, many stories about how family members report that their grandparents or parents or friends and neighbors can still engage in music, even in the more severe stages of dementia. So music is something that really is powerful as a trigger for memories, and in particular music memories. And this can help soothe somebody and help make them feel more comfortable and maybe in their surroundings and give them a little grounding.
Oh, that's wonderful.